Hi, good evening, everyone. Welcome to this evening's Arden University webinar on epidemiology and outbreak control. A very topical subject at the moment. So I'm very happy to be joined by Ukono Obasi from Arden University, lecturer on the Healthcare Management Bachelor's course and module leader for Public Health and Health Promotion. Ukono, welcome and nice to have you here.
Thank you, Matt. Hello, everyone. Good evening, good afternoon, wherever you are. Good morning, wherever you are in the world. Welcome to this webinar. Great to have you join us.
Absolutely, and I think we do have attendees from all over the world joining us at the moment. So thanks for taking the time to come to the webinar, whether it's morning, afternoon, or evening for you, wherever you are. Ukono, can you just tell us a little bit about yourself, your professional background, and what you do at Arden University?
Okay. Yes. So as you rightly said, I'm a healthcare management lecturer at Arden University. Which focus on the bachelor side of the healthcare management team. So I teach people who are looking to manage healthcare settings. I'm the module leader for public health and health promotion at the university. So I lead on all the issues around developing the healthcare course delivery, evaluation of public health and health promotion at Arden University. And my background, I consider myself really as a public health specialist. So before I worked at Arden, my last major role was working at Public Health England, where I was involved in designing the NHS diabetes prevention program. And I have, been involved in commissioning, design, delivery, and evaluation of a range of public health programs at different levels. I'm a bit politically active, if I want to mention that. I was the parliamentary candidate for the Liberal Democrats in the 2017 and 2019 general elections.
Okay. So you're the right man to have with us for the webinar today. Just want to say to all the attendees that at the end of the webinar, in about 30 minutes time, we'll have a chance for you to send any questions that you'd like Ukono to answer. So if you see on the webinar dashboard, there's a questions section there. So if you just type in your questions, and we'll just pick a few out at the end to go through before we finish the webinar. So if we just take the first point then, could you give us a bit of an overview about what epidemiology is?
Okay, so when we talk about epidemiology, we're talking about a branch of public health which is the study of the incidence, distribution, and possible control of diseases and other factors that relate to health. So it's essentially a study of how diseases move around in society, how it occurs, how they spread, and all the factors that lead to that. It looks at anything that relates to why diseases occur, and it also looks to understand how it can be controlled. So it essentially is about studying disease behavior and all the factors that relate to disease behavior.
Yeah, and just to go a little bit more specifically, what kind of investigations do epidemiologists carry out, and what kind of issues do they look at?
Well, epidemiologists are, as public health professionals, as I've said, they look at patterns, they look at disease patterns. So they try to understand what are the ways diseases occur within human population, but not just about diseases. They also look at injuries. And the reason why they do this is to reduce the risk and occurrence of disease. And they also look at how they can reduce the negative health outcomes as a result of disease occurrence. They are also involved in research, and they're also involved in community education and developing health policy. Now, essentially, when you talk about epidemiologists and what they study, they try to look at, you can group it into three categories. So they look at the agents of disease, so the things that actually cause diseases, like vectors and viruses and bacteria. They look at the host, so that is the humans or the living things that carry these agents, so like us, animals, and of course, they look at the environment. So the things that are around us that predispose people to having different risks of different conditions, people's work, people's housing. They all look at those things and how those things may put people at risk of diseases, how those diseases spread. And of course, we know that diseases themselves, or communicable diseases themselves, can be looked into or can be grouped into endemic and epidemic diseases. Now, endemic diseases are just normal diseases that occur regularly within a population. So routine diseases like you know that you could have a cold outbreak in the wintertime within a specific period. And then you have the epidemic. Now, the epidemic is the type of disease that is that spreads quickly across a large population. So once you have a disease that spreads very quickly over a large population, you're talking about an epidemic. And then when an epidemic spreads across international borders quickly, and then you now call that a pandemic. And that's, obviously what we have now. But as I also said earlier, epidemiologists also investigate non-communicable diseases. So, but most likely the things that they do tend to investigate are outbreaks of diseases. And in this case, you'll see them very much involved in, an epidemic, and especially a pandemic as we have now.
Yeah, and just a little bit later on, we'll be talking about the current COVID-19 situation in a little bit more depth, and it'll be great to hear your opinions about how different countries around the world are dealing with the current situation. Could you just tell us a little bit, Mukonu, about the kind of data that epidemiologists look at, and also an added point here. How important is it to be comfortable with numbers and mathematics if you want to work in epidemiology?
Oh yeah, very, very, very important. Very, very important. Let me just talk about some of the key things that epidemiologists look at, some of the types of data that they look at. Now, as I said earlier, epidemiologists try to study patterns of diseases and how they behave in the population. So a number of things that they look at what are those factors, what are those things in society, in the environment, environmental influences. So they study, they want to understand things like weather patterns and how it influences diseases. They want to understand air quality and how it influences diseases, how we drive, how we walk, what we eat, the food we eat. All of these things are in our environment that influence disease occurrence. They also look at what we call predisposition. So how likely are people to have a disease as a result of the way they are? So you're talking about things like our age, our gender, our ethnicity. So these are things that could predispose people to diseases. So you have to have data. They collect data on those things because these are things they would also analyze and look for patterns and correlationships to disease and disease spread or infection. Then they also look at behavioral characteristics. So these are things that we do, the normal behavior that we have, sexual behavior, social behavior. All of these things are also things that can be collected and analyzed by epidemiologists in order to understand, how diseases are spread. So when you then start to look at what epidemiologists do, you start to hear terms like incidence or mortality. Now, these are terms, in fact, there are things that can be calculated. So they are talking about incidence, for instance, talks about how a disease is spread. So how much of a disease is spread. Mortality talks about how the life cycle of a disease, how many people does it actually kill within a population, how dangerous it is. And they're able to take all of these and develop a number of ratios, a number of comparisons that will enable them determine, one, how much of the disease is spreading, how fast the disease is spreading, who the disease is spreading to, who is at risk of these diseases. So these are, it's a very interesting area of public health. And like you said, you really need to be very comfortable with numbers in order to be involved, to study epidemiology and practice that career, because you are constantly having to do with numbers. You have to be someone who is attentive to detail, and you have to be able to analyze information in order to see the patterns, because it is the patterns that give you the information about what is going on.
Yeah. And before we just start talking about the current pandemic that everyone's dealing with at the moment, can you just explain why is it so important to study outbreaks?
Well, that's a very important question. Okay, so the main reason we study outbreaks is to control, reduce, and eliminate the spread of disease. That's it in a simple term nutshell. The more we know about a disease, the better we are able to control it. The more we know about it, we are able to reduce it so that it doesn't become a pressure on our healthcare system. And the more we know about the disease, then the better we're able to eliminate it and find treatment for it and a cure for it, or even better, prevent it from spreading further. So when we understand how diseases occur, we understand the factors that cause it to spread, then that allows us to know who is at risk. And when we know who is at risk and what makes them to be at risk, then we can start to change things. We can now start to change our environment, change our behavior, put policies in place, establish different procedures that will ensure that the disease is not going to spread further. Another reason we study epidemiology, why I think is important that we study outbreaks of disease, is in order to evaluate if treatments work. Okay, so here we want to be able to look at treatment when we find them. We want to see if they've started to have an impact on the disease. So we need to be able to see if there's a difference. Is there a difference to how the disease has been spreading? And then we put a treatment in place. Will we see a difference? Will we see either a reduction? If we don't see a reduction, then obviously it's telling us that this disease, the therapy or the treatment hasn't really worked. And if we do start to see a difference, then we know that the treatment has had an impact. And that the epidemiologist studies to see if the result or the therapy has actually made any change in the treatment that you've come up with, and how fast that treatment is, how effective it is. That is measured when we start to see a difference in the patterns of the disease that epidemiologists study.
Yeah, so that takes us on to the next point, just to have a discussion about the current coronavirus situation. Ukono. Yep. just to start off, do you think that more could have possibly been done at an earlier stage to maybe prevent the pandemic from becoming so widespread?
Right. Okay. Let's first of all try to look at the coronavirus, and how it actually came to be and what it's about. So coronavirus, the name coronavirus is actually just a name for a family of viruses which can cause a range of respiratory symptoms. So there's a range of respiratory diseases which are called coronavirus. Sometimes it might seem that this virus is the first coronavirus. Actually, it's not. So there are several strains of group of diseases which are all called coronavirus, like including SARS and MERS, which have had an outbreak in the past. However, COVID-19 has obviously been quite dangerous and more contagious than both of these diseases, like SARS and MERS. And because of that, that has led to the pandemic that we have now. Now, COVID-19 essentially stands for Coronavirus Disease 2019. That's the abbreviation. So it was, as we probably know by now, it was first detected in Wuhan, China, and scientists believe is a zoonotic virus. A zoonotic virus means that it made a jump from an animal into humans. So it grew from an animal, and by some means of evolution, it was able to jump into humans. And this human form is now what is being transmitted. Now, it's obviously the first major pandemic we've had in over 100 years, and we now have more than 3 million confirmed cases. Now, it's a very contagious disease. It's a very, very contagious disease, and that is the problem with it, because for a while somebody could have the disease and be asymptomatic, which means they are not showing any symptoms. And because they are not showing any symptoms, they're able to spread the disease. Now, in my view, I think the disease could have been, the spread could have been reduced with adequate testing. If we had enough tests to test people, we would immediately identify those from patient zero, or the first person who had it, or the first person who contracted it in a country. We would have been able to find out who that person was, tested them on time before they were able to spread it to other people. And then we would have needed to do case detection. So case detection and tracing is to identify the people who have it and then trace the people who they could have gotten in contact with and therefore could have spread it to. By doing that, we would have been able to identify those people, test them, and also do the next thing, which is self-isolation. And then we would have been able to isolate those people who had the disease or who could have contracted the disease. We could have also done a bit more social distancing earlier, in my view. That's what I think. When you look at the chronology of the spread of disease from China down to it's around Asia, and when it came to Europe and to America and obviously to the UK, we, especially in the UK and maybe in the US, they were a bit behind the curve in locking down and enforcing those social isolation, social distancing rules that would have helped to prevent the spread. Another practice is obviously good hygiene. So we should have good hygiene, regular hand washing, to make sure that you clean the virus from surfaces. We know that the virus, as a virus, it doesn't survive very long outside of a human being. So good to just wash your hands, clean surfaces, and make sure that those surfaces are clean, because as long as you're doing that, you are wiping out the virus around your area, and which makes it harder for people to pick up. And then another measure, which I think is also important, is to make sure that our frontline health workers are adequately protected. We know that in a pandemic of this nature, there will always be people who will contract the virus. There will be people who will get it, and they will have symptoms severe enough that will require them to go to hospitals. So you need to make sure that healthcare workers, frontline key workers, are protected, because these people come in contact with a lot of people at the same time in a short period of time. So you not only want to protect them so that they don't spread it to others, but also obviously to protect them so that they are able to carry on working to care for the people who are going to become ill. Because one of the biggest problems of this coronavirus is that because it spreads so quickly, it gets a lot of people ill, and a lot of people require require health care. And if so many people need health care at the same time, the healthcare system becomes overwhelmed. And that is actually the danger. That is actually the problem. So when we talk about social distancing as a means to bend the curve, as is a phrase you'll probably be hearing a lot of, is trying to make sure that the spread doesn't happen too quickly so that it does not overwhelm the healthcare system. Because if you have the healthcare system that is overwhelmed, a lot more people die because they're not able to get the healthcare treatment that they need while they are sick. But if you spread, if you bend the curve and the incidence is not as high and is not as quick, as fast, as is not spreading as quickly as it normally would have, then the healthcare system is able to cope. It then has the capacity to take on people who are sick, and therefore those people have a better chance of survival had it not had the healthcare system be overwhelmed. And then the final step of obviously managing the disease is to develop and produce and distribute vaccines and or treatment. So you want to get to a point where we have a vaccine that is effective, that is safe, and that vaccine is distributed across the world. A high level of people take on that vaccine and are therefore protected and have immunity over the disease. And we also have an effective treatment that is able to treat the people who have contracted the disease, and so that they can recover quickly and will not need to suffer. So those are the key things that you're talking about. Detecting it early, testing, case finding, self-isolation, social distancing, good hygiene, protection for healthcare workers, and then developing vaccine and treatment.
So yeah, so is your thinking on how we eventually get out of this situation is it basically it boils down to finding a vaccine?
Well, I think that at the moment there will have to be an easing of the social distancing rules, because unfortunately we are just not built as human beings to be isolated for so long. But I think that the way we live, what will be normalized for us, will definitely have to change until we have a vaccine. I think people will still need to have some kind of precautionary behavior, maybe regularly wearing face masks when they go out, avoiding handshakes, using gloves when in public transport, limiting people who are on public transport at the same time so that you can have spaces between people. Some things will still need to be closed, stadiums, maybe even bars or large gathering places might still need to be closed. We still have to have some kind of measure to limit how we behave until a vaccine is found. I think without the vaccine, the risk of having a new spike in the spread is just too high. I mean,
Yeah.
people talk about this disease and say it's mild. It's doesn't really, the prevalence is not that high. But when you think about how many people is going to spread to and how many people who are potentially going to be fatal for it, that is a lot. You know, for instance, if you take the UK, and you imagine that we have a population of 60 million, that's being conservative. I think we're higher than that. Let's say we have a population of 60 million people, and you have a disease that has a fatality rate of 1%, just 1%. That's, you know, that's a massive 600,000 people dying. That's
Yeah.
a huge number. So you don't want to take that kind of risk if, you know, if the disease has the potential of killing that many people. And that's why these measures are in place, because you know that you want to make sure that people are safe. You also want to make sure that the health system is not overwhelmed, because once the health system is overwhelmed, even more people die.
Yeah. I have a couple of questions that have just come in related to this. What are your thoughts on the herd immunity effect that a lot of politicians and some countries have been talking about?
Okay. Very simple. I disagree with it. I think it was a bad strategy to begin with. Herd immunity occurs when you are talking about you have an assurance that the people who contract the disease, when they recover, will have long-lasting immunity. That's when you can talk about herd immunity. The other way you can have herd immunity is obviously when you have a vaccine. And when you have a vaccine, you can then vaccinate a large proportion of the people, and those people now have immunity, and that's an artificial herd immunity. So you can have herd immunity naturally by a virus that you know that when people recover, they have long-term immunity, or you can have artificial herd immunity by dishing out vaccination. Now, in the case of COVID-19, we don't know that people recover and have long-term immunity. We don't know that. The research is still out on that. The evidence is not conclusive on that. So we don't know that. And of course, we don't have a vaccine yet. So in both instances, the idea of herd immunity simply does not hold water according to current evidence, because we don't have enough evidence to support that people have immunity naturally, and we don't have a vaccine to instigate artificial immunity. So as I said, if you then allow people to just have the disease, then what is going to happen is that a large proportion of them are going to get ill, potentially die, potentially overwhelm the healthcare system. And that is just not good. And that is, you know, that's not a scenario where you want to be.
Sure. This current situation is also a good example of how epidemiologists can work with governments to help inform, you know, the policy decisions that are being made at the moment. Can you just talk a little bit about that?
Yeah, absolutely. As I said earlier, what the key things, one of the key things that epidemiologists do is they help to identify those who are most at risk of a disease. And also, of course, the risk factors. What are those risk factors that put those people at risk? Taking COVID-19 as an example, again, we know that the elderly are more vulnerable. We know that men are more vulnerable. We know that people from ethnic minority background seem to be more vulnerable. So these are factors that we've already identified from studying this disease. Now, what that then does is it helps governments to come up with policies, come up with practices for healthcare professionals, and also information for healthcare professionals. So, for instance, when you're talking about the impact on BME populations, Black and ethnic minority groups, there's a certain study that considers the fact that the health inequalities could play a part. So people from those backgrounds tend to be the people who are doing more front-facing manual jobs, the people who are in the front line facing jobs, who are then more susceptible to the disease. And there's also another theory that, especially in Western countries, vitamin D deficiency, which is more prevalent among people of darker skin, is also a factor because it helps it undermines their immunity. The vitamin D deficiency undermines their immunity, and when the virus now occurs, it's easier for it to overwhelm their immune system. Now, these things help governments to now come up with policies and practice. Government can now think about how healthcare professionals should act and behave. Members of the public can have information. For instance, if you're someone from BME background, you can now think about if you want to get your doctor to advise you on vitamin D supplements. It also helps government to think about what kind of equipment, changes to infrastructure. We've just seen the construction of a massive 4,000 bed capacity Nightingale Hospital at the Excel Center in East London. These are as a means of trying to build capacity so that if the system needs room, it can expand and it won't be overwhelmed. And then, of course, all of these things now come down to getting government to think about the funding and the resources that should be allocated. Everything, unfortunately, always comes down to money. If you have to have the money to fight it. You have to have the money to provide for people in order to incentivize them to socially isolate. You have to have the resources to buy the equipment, the ventilators, the personal protective equipment for healthcare workers. You have to have the money to hire new staff or more staff if you need them. You have to have funding, and knowing these things and having the evidence is what allows governments to make these decisions and these allocations of resources. And that's what the epidemiologists help to provide.
Sure. Getting close to the end of time at the moment, so I'm just going to skip straight to this question here, Ukonu. What advice do you have then for anyone joining us tonight who's interested in a career in epidemiology?
Okay. Think the advice I would have for such a person is, first of all, you need to be someone who's passionate about people. You need to be passionate about helping people. Epidemiology is, to be an epidemiologist, you're taking on a career that looks at what happens to people. How can you save lives? How can you protect people? So you have to be someone who thinks about other people and what is best for them. It's a study, is a career that looks at the wider population, and you're trying to see patterns, behavior, factors that affect people's lives. So you have to be interested in people's lives in order to obviously understand what affects people's lives.
Sure.
As I said earlier, you have to be someone who's good with numbers. Okay, there's quite a lot of calculations. You need to know how to prepare charts and graphs and all of those things. That requires a good grasp of mathematics and calculations. So if you're going to think about being an epidemiologist, you need to brush up on your mathematics. You need to brush up on, and then you have to have an eye for detail and pattern. You are dealing with small margins. sometimes margins that are, in decimal places, in decimal points. So you need to be able to pay attention to detail and be someone who is keen enough to understand patterns. When you're plotting information, data, large data over large populations, over large periods of time, you should be able to read that information and see the patterns that they are forming. Because only when you can see those patterns, that's when you can see the relationships. That's when you can start to draw conclusions on what factors are affecting other things. And that is what will help you in your profession. Then you should also obviously have a good understanding of biology. You have to understand how viruses work, how bacteria work, and all of those biological elements. You also have to know how the human body works, how the immune system works, red blood cells, white blood cells, and so on and so forth, digestive system, etc. And then, of course, you should also understand social and environmental factors. Social and environmental factors such as employment, housing, all of these things have an impact on people in the environment. A lot of people have argued that global warming could have played a part in the coronavirus outbreak, because the more that we take away from our natural world, the more plant life, plants and animals, their habitats are taken away, the closer they are to human beings. And that means the closer they are, the more likely they are to spread those viruses that are more naturally occurring in animals. The more likely they are to jump into human beings. And then when you talk about the way we plant and we produce food, especially meat, you can see that the opinion is that coronavirus came from a live market in Wuhan, where because of the close proximity of these animals, the virus was able to jump from one species to another, therefore evolve, and therefore it was easier to then make that transition into human beings. So these are all things that an epidemiologist has to understand. You need to be able to be someone who can see the bigger picture, understand relationships, understand numbers, understand patterns, and of course, have a passion for caring for people or doing the best for people.
Sure. And I should just say to the attendees right now that if you want to take a look at the program that Ukono teaches on, you can go to the Arden University website, which is arden.ac.uk, and you can find the BSc in healthcare management there, which is available to study in two different ways. You can study what's called the blended option. Usually under normal circumstances, that involves about 8 hours of face-to-face study per week in one of Arden's UK study centres. At the moment, that feature of the blended learning option has actually moved online using Adobe Connect. The other option for anyone is to use the fully distance learning study mode. So that's completely 100% online, where all of the course activities take place on your computer on the online learning platform, and that means that it doesn't matter where in the world you are, you can be literally anywhere and still study one of Arden University's programs without actually having to attend a physical campus. It gives people a lot of flexibility. Also, if you go to the handouts section of the webinar deck, you can see the actual course prospectus for the BSc in healthcare management. So you can just quickly download the prospectus there, and it gives you a full breakdown of what's included in every module that you'll study on the program. Okay, Ukono, so I think we'll go to a few questions that have come in now.
Okay. Just
before we finish up. Okay, here's one. So if COVID-19 can be asymptomatic, how sure or certain can we be that the current statistics that are being published are reliable?
Well, the thing is, we are not specifically guaranteeing that they are reliable. The data that is being published is an indication, and that is what you're always going to get, even in the best, in any situation. There's never a time that you will be able to test all the population all at once. That is obviously never going to happen. But what you want to do is to make sure that the test is widespread enough to give you a good representation of the population, so that you can then infer what the result is to the whole population. And unfortunately, I don't think we're there yet. And that is why I'm saying I think we really need to up our testing. That is the only way we can hope to come out of this lockdown period, if we have a good indication of what the spread is, because right now we don't really know. And you're right that in terms of it being a lot of people being asymptomatic, we don't really know how bad it is. So we do need to amp the testing. The government says that right now people who are frontline healthcare professionals, so those in the NHS, those in the care sector, and their families are eligible. They're also now starting to test those in the care sector, not just those with symptoms, but even those who are asymptomatic. That's good, but they need to do much more. I think it is possible to move testing into the community. If they can move testing into the community using some community hospitals, use pharmacies, use some GP practices that have the capacity to do that, I think we really need to amp up our level of testing, so that a significant population, a significant portion of the population would be tested, and then that will give us a good indication, a real indication of where we are with the spread of the disease, and that will be, give us a good plan for how to get out of lockdown.
Yeah. Another question here. If a vaccine doesn't become available until later in 2021, is a second COVID-19 spike inevitable towards the end of this year?
The experts say yes, and the reason why they say yes is that because the virus is such a contagious disease, as soon as we get to the point of having cold weather with other respiratory infections and diseases, it will probably come along with that as well. And they suspect that it might be worse than what we even have now, which is a terrifying thought. So I think that is why governments and the WHO are working very, very hard to come up with a vaccine. And we are, from information reaching, is that we are on course to develop get the fastest developed vaccine in the world, in terms of making sure that we are running there are a number of studies already going on. We know that a number of vaccines have already gone into human testing, which is the last level of test for any vaccination, and we expect to start to see the results in the summertime. And if we start to see the results in the summertime, then there's every reason to believe that by the fall or in the autumn, we will have a vaccine on hand that can be rolled out in the population across the world. Now, the challenge is that, one, obviously the logistics of getting the vaccine to everyone and making sure that you have a vaccine that's safe for everyone. Now, there are different people with different health needs. There are people who are immune deficient. So you have to think about what type of vaccine are you giving them? Will it cause them more harm? So you have to think about all of these things. And I think the key thing which I'm seeing is that there's a variation in the vaccine development. There are a number of vaccines that are being studied and being looked at, and hopefully we do anticipate that there should be a vaccine before next year. That is the hope. It would not be good for the world if we see another winter without having had a vaccine.
Absolutely, yeah. We have one last question here that's been sent in. In terms of travel, do you think that as a society, as a global society now, we're just going to have to completely rethink the way that we think about travel and cross-border issues?
Yeah. Well, everything will change. Everything will definitely change. I think the virus will change society. It has changed society. Even talking about things like shaking hands. How many people will feel comfortable just going back to just shaking hands and hugging people? How many people these days, if you were in public and you coughed, people will look at you funny.
Yes.
A cough has somehow become something people worry about. So I do think it will change how we travel. We're already seeing a scenario, as I mentioned earlier, where if you're going outside, you'll probably be required to wear face mask or hand gloves or both. I'm seeing a scenario where in airports, they will have thermal monitors to monitor people's heat temperature to check that they don't have any fever or any other symptoms of coronavirus. And as tests becomes more advanced, you could even have people being required to test at international hubs before they travel. So these things will happen. And I think as long as we have not eradicated the disease, as long as it is still with us in some form, we will definitely have to rethink the way we travel, the way we move, and indeed the way we interact as a society. Which it is a shame, but I think I would like to hope that we will also learn the lessons, appreciate each other more, appreciate our healthcare workers, our key workers more, appreciate the people who normally are not appreciated, because these are the people who we've had to call on to put themselves at risk when we couldn't go out, from nurses, doctors, post office, bin collectors, healthcare workers, drivers, train drivers, bus drivers. All of these people have carried on working while society more or less ground to a halt. So hopefully we should start to appreciate those people more, appreciate our planet more, because obviously when we've been indoors, we haven't really enjoyed going outside, going out, meeting our friends. And we can see that it's somehow that lack of travel has made a difference in air quality, in some of the waterways in the cities have become cleaner. These are all things that have changed. So in some ways, it will change how we behave in not so good ways. But hopefully, when we also come out, it will change some of the things that we've experienced in good ways.
Yeah, great thoughts to end on there, Ukono. I'd just like to say thank you very much for joining us tonight. It's been really informative, extremely interesting to listen to your obviously extensive knowledge and experience in this field. So I'm sure the attendees will really appreciate everything that you've passed on today.
Thank you. It's been a pleasure.
Great. I would also like to say thank you to the attendees as well. I know that the announcement for this webinar was a little bit short notice, so it's really appreciate everybody who joined. And you'll should be receiving an email sometime tomorrow with a link to a recording of the webinar. So if there are any points from Ukono that you want to listen to again, you'll be able to have a look at the recording. So just like to say thank you very much to everyone, and Ukonu, have a good evening.
Thank you. Goodbye, everyone.
Goodbye.
Take care.